Welcome to Cyber Survivor. I'm the host, Dan Dodson, and today I'm joined by a woman that has 40 years experience in practice management, and we're excited to explore all of what she brings to the table. So, Kathie Philippou, welcome to the show.
Thank you. Thank you. I'm excited and happy to be here.
Yeah, looking forward to learning from you. So let's start with some background. Why don't you give us a little information on how your career has developed and what gets you here today?
Sure. So I started in my early 20s. I was looking for a new position, and this position opened up for a small OB-GYN practice as an assistant to the office manager. And so they hired me, and I started in a very humble beginnings. Actually, my first office was in a basement, and it was literally cinder block walls, no windows, this metal desk and this light kind of in a corner, and that was my office. Um, that was very humble beginnings for sure. And then the practice manager there became pregnant and left, and they ended up promoting me to that position. So it then we moved out of this small little building in a rural area to a St. Joe Mercy Hospital complex that they had just built. And we expanded to 3,000 square feet. And I ended up starting recruiting people, physicians, nurse practitioners, midwives to the practice. And so I did that for 11 years and then ended up moving to the Philippines for 2 years for my previous husband's job. So I lived over there and came back looking for a position and worked briefly for an ENT group and then moved to Georgia. And that's where I've been ever since. And there was a doctor in Michigan who I worked with, and he moved to Georgia and he decided to open his own practice, and he started recruiting me to come down here and help him open his practice from the bare beginnings. And my previous husband took a job in Kennesaw, closer to Atlanta. So that's where it all began. And continued. And so I've been here in Georgia for about 27 years now, working in the same industry.
That's great. I am sure that you've seen and experienced firsthand the digitization of healthcare for sure. So take us back into the cinder block room. What was that like from a technology perspective? I mean, how were you running
Yeah.
the practice? What did that look like?
Well, we started out with a pegboard system. And so that was like, everybody had a little card as a patient, and whenever they checked out, you put that card over some carbon paper and you wrote on it, and then it went to this ledger that was underneath. And so you would put in how much it cost, how much they paid, if there was a balance. And then I had to go and break out all those numbers by hand, of course, and balance these ledger sheets and break them out in according to the doctor, so we could see what the doctor was producing and what his income was. And there was probably, I don't know, I want to say 50 lines to a ledger page. So I
Wow.
had to do all of that. And I'll never forget one time I made a mistake about 10 pages back, and I had to go and manually correct everything to make it right. And I just remember sitting there like, you've got to be kidding me, erasing. It was, yeah. So I was glad when we moved to a computer system, that's for sure. And so that's
Yeah.
when the first practice management system started coming out. Oh, I want to say late 90s, I think, is when that started coming out. So,
And were you excited when that happened? I mean, were you looking forward to that?
yes, yes. Because
And what
now, because now you didn't have to have an appointment book, right? You didn't have to have all that was going to go through the practice management system. And again, all of your visits and whatnot went through that practice management system. So, and then you spit out reports, right? I mean, you could still have to balance things, but you had a report that you were working with instead of all the manual activity that you had to do. So,
Yeah, absolutely. And what did the clinicians think of this? Were they as excited, or were they doing any charting, or was it just mostly practice management kind of back office at the beginning?
Right. So, no, the EMR did not come around until actually when I moved to my in 2008. So, in the early 2000s is when electronic medical records started happening. And that was a huge adjustment for practitioners. Prior to that, everything was paper and a chart. And we used to take hours making up these charts, for new patients. And you had all these tabs and dividers and whatnot for organization. And, phone notes went here and labs went here and notes went here. But for the doctors, they were handed a chart. They could look at everything. It was right there. So the practice that I joined here 15 years ago, they tried an EMR and it failed. So when I came about a year later, I moved us to a new practice management system, and then I moved us to an EMR system, and that was a process. That was a process. I mean, you had to go and build templates for your notes beforehand, and until you really get into something, you can do all this prep beforehand, but until you're in it and you're doing it, that's when you figure out what your needs are. So I'll just never forget. I'd have one of the doctors come into my office all the time, and he'd go, "It takes me 10 clicks to do this." 10 clicks. That's too much time. I mean, all I heard about was the clicks, and I get it. I get it, but again, the government at that point was forcing us to go
Mhm.
into using EMRs. And I believe that started with uh, George Bush Jr. So
Yeah,
when
yeah,
he,
George.
yeah.
Mhm.
So that then created a whole nother dynamic because at first what they did is they incentivized us. They gave us money. You
Yep.
do this, you meet all these measures, and we'll give you $20,000. And so but slowly they backed off on that. Each year the money was reduced, and then it became, we're going to penalize you. So we're going to penalize you if you're not meeting all these measures within your EMR system. So that was very difficult. And it just continues to be a burden because now they went on to say, well, you're now responsible for the security of all this. And we're going to fine you big time if there's a breach or if something happens. And so every medical managers conference that I've been to, which I go to them annually, I mean, you just hear constantly about if you don't do this, if you don't do this, if you don't meet this, it's going to be $50,000. It'll be $80,000. It'll be $1,000,000 if there is some type of breach. And so that weight of that burden would keep me up at night because, people aren't perfect, right? And so, cybersecurity became this big issue for us. And it's not cheap because you have to bear the burden of the cost of it. So you're now in a position where you're having to make sure all your equipment is, locked up and that you've got all these security measures on all the servers and all these things that are technical. So you have to have a very good IT company that works with you in order to help you get to the place where things are less likely to be attacked. So,
Yeah, I think that's right. I mean, you're right. It started under the Bush administration and then got codified under Obama. Meaningful use, as a lot of people refer to it as, is
oh
really
yeah,
the digitization of healthcare at the industry level. But you're absolutely right. There was little to zero consideration at that time around cybersecurity, right? So
right,
that dynamic kind of came later,
yes,
and what we see is that medical information is so valuable to our adversaries.
yes,
Um, it's more valuable than credit card data because it can be monetized in many different ways.
right, right, yes,
And then the recent trend really is ransomware, because if
hmm
care gets disrupted, these practices exist to deliver care in these communities, right? We want to
Right.
take care of patients. And
Right.
so there's this leverage that's kind of inherent in our industry that the adversaries have because we got to get back online to protect patients.
Right.
Um, so you mentioned the conferences and all the conversations around cybersecurity. Take us inside the practice. What were people talking about or are talking about relative to cybersecurity, and how are they thinking through at that level what they need to be doing to be secure?
Well, so as you talked about meaningful use, it is now morphed into it's called MIPS, MIPS. And it is what, if you are a Medicare provider, these are measures that you need to meet in order to not be dinged for your Medicare reimbursement. And so part of that is cybersecurity, and that's become a whole section of HIPAA, really, and a separate entity now that we have to learn about, study, and teach. So, for instance, annually, you have to prepare your staff and teach them and certify that they've learned about cybersecurity so that they understand that what that means and what can happen with it. Because what they're showing right now really is that when you get hacked in a medical practice, much of it is coming from within, from your people accidentally clicking on something, looking at an email, thinking it's okay. And so you're having to teach them all about those type of intrusions that could possibly happen. So it just keeps morphing into more and more that we have to look at and observe. So within the Meaningful Use MIPS program, you also have to do a security risk analysis every year. So you're supposed to go through your whole systems and look at them, look at any possible ways where there could be an intrusion. You have to walk through your office physically and look at things. So it's become a huge issue, and they continue to morph that into more and more in-depth study into how you can prevent it in your
Absolutely.
practice.
Yeah, absolutely familiar with those frameworks. But it sounds like a lot of that responsibility really fell on your shoulders. So how did you learn about this? I mean, you're not a technologist, right? I
Right?
mean,
No,
you know how to take care of patients and
no.
serve them
Right,
and,
right.
and serve the clinicians and support them and grow the practice and recruit physicians. And now you have to be a cyber expert. So how did you tackle that? How did you learn about it?
Um, so there are resources. I am part of the Medical Group Manager Association that is national within the country. And then on a state level, I am part of that as well. And I sit on the board for the state. And in a previous past president, so cybersecurity has been at the helm of what we bring into our conferences. So, and MGMA pushes out information all the time that gives us guidance. They also have a lobbyist that works in DC, so they're constantly going back to the government to say, hey, this is a burden, or what works for you, what's not working for them. And the part about medical management now, it has become so onerous with all the compliance issues that we have. So it's not just cybersecurity. It
Mhm.
is, you have to be with OSHA and HIPAA, and you have to do all these different programs that they push on you. And now it's like your responsibility to learn about them. So conferences, resources, reading, teaching myself, IT help through that process. And also medical practice, what do I want to say? Liability companies, they're coming out with resources for you as using their losing my train of thought here, using their companies, right? So medical practice liability, that's where that can also come in and be a problem. So they have started giving us resources on cybersecurity. MGMA, again, they have a whole, you can earn a education badge on cybersecurity. So they just continue to help us and teach us. And every year it changes too. Like the government will change things all the time on you. So you think you've learned it, and now they've added another layer or another step that you have to comply with.
Yeah, so you're kind of a compliance officer on top of the daily duties, on top of the cyber duties. So it's a ever expanding role.
Yes,
Do you think that you mentioned earlier that the responsibility lies primarily on the practice to make sure that it's
yes,
secure,
yes,
um, on the backs of a mandate to be digitized, to have an
right,
EHR?
yes.
Do you think that's fair? I mean, is that a fair way to think about and place that responsibility? I mean, where should that lie?
Well, a lot of it I don't think is fair. The government is actually very much involved in healthcare as much as we don't think it is, because
Yeah.
we're not in a country where you have national healthcare, right? So they're constantly in there, just making things more difficult for us, and puts the burden on us. So for instance, here's an issue where they are, if you, as a state, the state comes in and tells you, here are the top languages that are in our state, okay? And you need to now provide interpretation for these patients when they come in, okay? So we've all had to get sorry, my phone's, so we've all had to get an interpretive service. And those patients come in and we get charged by the minute, and we're not allowed to charge the patient. We
Mm-hmm.
have to deduct that amount from what we get reimbursed by that insurance company. So we might get reimbursed for an office visit $80, and we have to pay $40 for their interpretation, and we can't pass that on to anybody. So we're really the one industry that, when the market goes haywire, or we can't pass off tariffs to our patients. We can't pass off any increases to our patients for the cost of doing business,
Yeah.
because it is all set within our contracts with insurance companies, and you're tied to those. So
Yeah, you're right, and you touch on a couple of good points. Not everybody may realize this, but yes, we do not have nationalized healthcare, but majority of healthcare is provided or funded by the government between
yes,
Medicare, Medicaid, CHIPS
yeah,
programs, etc.
correct,
The VA, on a
yeah,
dollar basis,
yes,
and you have this growing responsibility from a compliance perspective, kind of in and around cybersecurity is just one element of that.
right,
But you can't change the revenue side of the equation, and so that
no,
puts the practice in a unique position where um, they try to control expenses the best they can, but
yes,
they're dictated in some regard that they must do these things. How does that dynamic play into the availability of dollars or resources to tackle cyber challenges? I mean, it probably becomes difficult to get
right.
resources within the practice to do that.
Right, it does, very much so. Um, our first security risk analysis that we did, where we got an IT company to come in, and this was early on, 2010, 11, 12, somewhere in there. It cost us $5,000 for them to do a security risk analysis for us. And we're just hoping, and that was part of the whole, meaningful use MIPS measures that we have to do.
Yeah.
And we're lucky if we get any money from participating in those programs. They've made it a neutral based program, so that the high earners or the high performers are supposed to here's the pot of money. High performers are supposed to get X amount, because the low performers will then not perform. Well, our first amount that we got for meeting those measures was 1.8%. So you're spending $5,000, or if you've got a company that's coming in and working with you, it's thousands of dollars in
Oh
order
yeah.
to make sure that you're protecting everything. So
Yeah, so the program doesn't fund itself, so it comes out of the back of the practice, basically,
Yes,
at the end of the
yes,
day.
yes, it does.
So it sounds like you have robust regulatory pressures
Yes,
for compliance,
yes,
with limited, funding to help
yeah,
you navigate through that, and you've got declining reimbursements over a
right,
long period of time. I mean, I'm sure you've seen in your
correct.
career that reimbursements have gone down, not up,
Yes,
while
yes,
costs are going up. It creates a
yes,
dynamic for
yes.
sure.
It's becoming increasingly difficult, especially in private practice, to keep your business so that you're not ending up being bought out by a hospital system. And when you're bought out by a hospital system, all of a sudden doctors do not have a say in how things are done or run. And now the doctors are put in all kinds of pressure because they have to meet certain needs that the hospital tells them to as far as how many patients you see a day. So there's this whole backlash for that, and it makes doctors very unhappy to be in that position. They think that it's going to be a relief because they don't have to worry about payroll now, they don't have to worry about overhead, they don't have to worry about their buildings that they have, and but it really, many of them become not happy, and then if you're not producing like the hospital system wants you to, you're out. They'll just say sorry, see you later. So it's yeah, become a
So
big.
when Yeah, I understand that for sure. My father-in-law is an eye doctor, and he had a multi doctor practice, but wasn't large in the grand scheme of things. And you're right, the regulatory, the cyber, the challenges to run those
I,
practices
I
just
I
became
lost.
so wild and very, very challenging to do that. So was your practice able to weather this storm and stay independent? Did you ultimately join up with a hospital or health system, or how did that look?
No, we have continued to be independent. What was so interesting is when I started there, one of the managing physician at the time was in talks with the hospital. They were just starting to look at possibly buying practices, and he started talking to the CEO of the hospital. And when I interviewed, I said to them, I will do everything in my power for you not to become a part of the hospital. And we were able to achieve that. So they still are not part of a hospital system, and they are still independent.
That's great. So thinking about cybersecurity, how much conversations did when you were in management meetings with the doctors? Like how much time was spent talking about cybersecurity?
A lot. For me, one of the big things too is all the devices that you have. So we're talking your laptops, we would have to get them encrypted so that if anything happened, that was another measure of help with cybersecurity. You could tell OCR, yep, my computer was stolen, but it's encrypted, so we're good. Um, what drove me nuts is phones, and texting about patients and making sure that that was secure, and all the different devices that people have at home. It's not just what's in the office, especially with providers, because they're taking their laptops home or they have desktops because they're working, they're on call, they need to have access to the chart. And so there was a lot of talk about that and trying to make sure that that was secure. We ended up putting in a camera system so that, again, you can see what's going on if anybody came in the office and was trying to do any type of penetration of some sort, even if it was to steal, a laptop. We
Yeah.
had that in place. So every year it was constantly looking at how to make it more secure.
And when you were in those conversations, one of the uniquenesses that oftentimes is when you're talking about a physician practice is that, the physicians typically own the practice, right? So every dollar that they're spending in cybersecurity is a dollar coming out of their own pocket, which is
Right.
already getting pressure for all the other things we talked about.
Correct.
What type of pushback did you get, when you had to spend more money? Take us into that conversation. What was that like when they were trying to balance, their own personal income,
Right.
the survival of the practice,
Right.
regulatory requirements, and the need to protect patient information? What did that look like?
Well, they were they're pretty open to it. Like we had to get new servers and we had to get a cloud type of system involved. I mean, and it was just the cost of doing business. We had to do this. And if you wanted to continue to practice, these were the measures and things that you needed to do. My biggest pushback probably would be on their devices, at home, because I couldn't control those and I didn't know what they were using, and that would make me more uncomfortable. But they were very responsive. So,
Yeah, that's great. That's a definitely balancing act, trying to find the right funds and keep the practice afloat.
correct.
Um, absolutely. So we're all patients. How secure do you think healthcare is from a cybersecurity perspective? I mean, how much confidence do you have in these practices' ability to identify risk and
Right,
mitigate it and
right.
defend against an attack?
Well, I know again, it's forefront in everybody's minds. I'm leaving tomorrow to head to Hilton Head for a medical managers conference, and we have a whole session on cybersecurity, and that's really what happens every year is we've got to refresh, and um, I. They say that sometimes the smaller practices are easier to hack and get into ransomware. I've seen I've seen different EMR systems get hacked and shut down. Um, I have seen, like, for instance, this is sort of cybersecurity in a sense, is received a couple times emails from what it looked like was one of my physicians asking me to they wanted to change their bank account for where their payroll would go. And it looked legit and whatnot. And I looked at it and I'm like, I looked at the email that it came from, and both times those were penetrations that came into me asking me for and giving me erroneous bank accounts so that their money could go into those. So, you just have to be vigilant and aware of everything all the time. And um, I think, it's as safe as it can be, right? I mean, the IRS got hacked. So banks get hacked. But medical will shut things down because you can't, especially in a hospital system, like you can't do surgery. You can't
Oh,
do, you know, major basic care because you have no ability to see those notes. Now, with my practice management system, if I lost Wi-Fi, for instance, because when you lose Wi-Fi, you can't have access right to your medical records.
yeah.
I have the ability to go and download my list of patients and then get their medical records for the past 3 days. So I had some access to that, but it's I guess it's as safe as the government's own issue with being
Well,
hacked into, right?
yeah, I think that there's it's not a matter of if, it's when. So it's how
Yes,
do we prepare ourselves for this?
yes,
The type of attack that you were talking about is largely kind of categorized as phishing, where these bad actors try to
right, right,
get you to click on a link or change a bank account. It's
right,
kind of
right.
widespread. But you touched on something that's really important. I think that as a society, there's been somewhat of a we're less sensitive to having our information stolen. Nobody
Yes,
wants that. I wish that wouldn't happen, but
right,
we've all gotten the credit monitoring, whether it's a
yes,
big box retail or something like that.
right, right,
But uniqueness in healthcare is, look, patient lives are at risk. And you
right,
mentioned that, healthcare can't be delivered to the same level of care without technology because we're so
correct.
reliant on the
Yes,
EHRs and the other systems,
yes, yes,
for sure.
yes.
You you may not have directly experienced this at your practice, but you mentioned some stories that of
Mhm.
practices that have been hit. Anything that you want to share around what those practices experienced? Were they able to recover from it? Did they go out of business? Did it disrupt
Yeah.
care? Share some stories with us that you may have.
So, one of my good friends, locally in here in Dalton, she experienced her EMR system getting hacked, not into her practice, but into the company as a whole. So they were having to work through about 7 days of not having access to things. And that was on the EMR company, and there was no retribution for them as far as their, them having to offer patients, monitoring or credit monitoring or whatever. And it was difficult. It probably took about, I'd say, a whole month to resolve itself completely.
Yeah.
Um, and I don't know this practice, but this happened in Athens, Georgia, where there was an orthopedic group that got hacked into very early on. And it was done by the Dark Horse. And that really shut them down. And I do believe that they paid money in order to get
Recover.
access and to recover. And I think they recovered. I think, most practices probably will be able to recover. What I did is through my liability insurance company, we got cybersecurity insurance.
Yep.
So, and it's getting harder and harder and harder to get because there's been so many hacks or so many type of infiltrations that have happened. And so each year when I would go to renew, I would get this list of more things that I had to make sure that I was complying with in order to be insured. So,
Yeah, that's absolutely right. There's a huge trend in cybersecurity that, when you're filling out for the cyber policy, the attestations that they're requiring the insured to make is
yes,
increasing. One of the things that keeps me nervous, Kathie, is that in the event that an organization has to make a claim, the first thing that insurance company is going to do is pull up that attestation and say, these are all the things you said you were
right,
doing. Let
right.
me make sure you were doing them. And if you weren't, then I'm not going to pay the claim. So
Yes,
it's a
yes,
wild world out there for
it
sure.
is. It
Um,
is.
and so, you know, looking at one of those stories when they, took them a week to recover, what was the impact on the patients? I mean, were they able to see patients? Did care stop completely? Like and you may not know that because it wasn't your practice, but like,
Right. I think care did not stop completely. I think they limped along and did the best that they could
yeah,
with, limited access. And, and that's what we do. Like, I'm not, when I say we, I'm not there at that practice anymore, but that's what we would do. Like, if we would have problems with our Wi-Fi going out, especially when you had storms come through or whatever, and I'd start getting the calls. We have no Wi-Fi. We have no Wi-Fi. So, I'm like, get on your hotspot. You know,
right,
connect somehow, or they would just get paper and go back to paper with the notes, and
yeah,
and try to make the best of that visit that day, and follow up once it had. So you're always trying to prepare for the disasters.
yeah.
So,
Downtime procedures are important for sure.
yes, yes.
Sure. Do you think that as an industry, we're more secure than we are today, given all of the conversations that are happening? You mentioned at conferences and different resources from the
Mhm.
state and the federal government. Do you think we're more secure now or less?
I would have to say more secure because, again, it is so much on the forefront of everybody's mind. And like you said, we hear all the time, it's not a matter of if, it's a matter of when. And so, you know, there's whole departments within hospitals that have, here's the compliance department and cybersecurity is over here, and that's all you do. So, I think that every hospital, clinical practice, everybody wants to make sure that everything is as secure as it can possibly be.
Yeah, I agree. Okay, last question. I'd love for your thoughts on this. So
Okay.
take me back to the cinder block room where you were completely paper
Yeah.
versus where we were when you left the practice. So
Mm-hmm.
in that 40 years, we completely digitized the practice for the most
Mm-hmm.
part.
Mm-hmm.
Was that worth it? Like, are the trade-offs worth it? Like being digital, we've got click problems, we've got cyber problems. Like, Was it worth it to do that? I mean, is care improved, do you think? Is it more coordinated? Is it more effective?
You know, it is fragmented, honestly, because when we were forced to go to EMRs, all of a sudden there's a whole plethora of them, and you're having to choose one. And then they wanted everybody to be able to talk to each other. Well, you've got different systems, and that's not easy, and it can't really happen. And then you're supposed to have like some type of secure way to access another practice or send notes or whatnot. That was a mess, and most people did not understand that that was a measure that we had to meet in trying to figure that out. There is a large system out there called Epic, and there are most of the hospitals have gone to it. A lot of the practices that have been bought by the hospital use it. That was something that I moved to about 5 years ago in the practice I was involved in, and it is a Black Hawk system, like a Black Hawk helicopter. It's huge. It communicates. You can see when they've been in the hospital. You can see when they've been to another doctor's office. You can see those notes. But it's still a process, and not everybody has that. And so I think that was one downfall of the government when they did this is they wanted you to be able to share that information with everybody, but they didn't set those parameters up in the beginning. And so it was very fragmented for a long time. And it still is. I mean, we're still getting faxes of people's records. They're faxing it. And I'm like, this is so antiquated. But some offices are still doing that. They're like, I'm not going to digitize. I'm going to stay paper. A lot of those are older doctors because they're like, no, I'm not doing it. It's just doesn't work for me. And so you know, uh, that's the goal. I mean, most of these EMRs have patient portals, which I personally like because then I can see my information. I can see when my lab work comes in. I can see all these things. But the downside of that is when patients' lab work comes in and they get a notification and it says abnormal, they're freaking out. And the doctor hasn't even seen it yet. So, and I don't know if you've experienced that with any of the physicians that you've gone to, but I mean, there's a lot of good things about it, but it has not been a smooth ride whatsoever in adopting all of this.
Yeah, I think you hit on a lot of points there. I think it's mixed results on, are we better off today than we were 40 years ago as it relates to coordination of care?
Yes,
One of the big, I guess, negatives that you hear talked about a lot relative to meaningful use is, to your point, we didn't consider the interoperability uh,
correct.
as much as we maybe should have.
Yes,
I know subsequently there's been a lot of regulation and a lot of movement towards more interoperability, but standards are still kind of all over the place, and it is very difficult to coordinate care. Um,
yes.
any last comments or recommendations or advice that you'd have to other practice managers out there, administrators, as they think about tackling the cyber challenges of today that you'd like to share?
I would just really plug into, your local, if there's local managers meetings, getting involved in your state MGMA, and then getting involved with MGMA as just resources because you get so many, and then they will give you toolkits. So they'll give you some information that you can, download and look at, and, it really helps you by, pointing out everything that you need to do and really just staying as educated as possible as you can in whatever way it works for you. I like to read a lot. I like to read articles and I like to go to conferences and hear things and have conversations with other people, with other managers. The networking is invaluable. What are you doing? How is this working for you? What company do you use? That's what I would suggest.
That's great advice. Thank you so much for sharing your story. I really appreciate your time today. And I'm Dan Dodson, and this is Cyber Survivor.